When a parent hears their child has been diagnosed with autism for the first time, they have a lot of emotions going through their head. Parents start to ask questions like, what is autism? How did my child get it? Will my child grow out of this? And what can I do to help my child? Doctors and other professionals try to answer every question to the best of their knowledge. Sometimes the parents' questions are left unanswered. Every child who is diagnosed with autism is different. A lot of children have the same characteristics but still are different in their own way. Autism is a spectrum disorder. It is a complex developmental disability that appears during the first 3 years of a child's life. Autism affects the normal functioning of the brain, social interactions, and communication skills. Children with autism seem perfectly normal in appearance. There are different levels of severity. Each child experiences different characteristics based on the severity of their autism. One of the biggest characteristics children of autism have is social behaviors. Children of autism do not know what is appropriate and what is not. They have to be shown and taught the appropriate social behaviors. The question is, how can we help? How can teachers, caregivers, and other professionals teach a child with autism appropriate social behavior? Children with autism can increase their social behaviors through social stories. Another question that might be asked by a parent is, what is a social story? A social story is a short, simple story that describes a social situation through text and visual instruction on positive, appropriate social behaviors. In order to make this work, the teacher must focus on one of the social behaviors at a time. The teacher must focus on what the child has the most trouble with, and then he or she writes a social story for the child. This stimulates the child to use these appropriate social behaviors throughout the day at school and at home. The story needs to be written for the age appropriate for the child. If the story is age appropriate, then it is more effective. The social stories are most effective in a more functional environment. The more functional the environment is, the more natural the child will be able to use the social behavior. Parents, teachers, and other professionals can also use regular children's books as an example of appropriate social behaviors. If the child sees a character in a book sharing their toy or saying thank you, then the child will model what the character did in the book someone read to them. Parents need to keep in mind that every child with autism is different, and this approach might not be the best for some children. Research has proven that this approach does increase a child with autism's social behavior. It would be worth a try to find out if this is best for your child.